clinical immunologist, Dr. Troy Torgerson, has a very different point of view.
The first thing that we are concerned about actually is infection. We didn't know what it was, so we were concerned that she might be contagious to other patients, and so she was placed in isolation.
They started coming in like spacesuit type things so they wouldn't breathe my air.
They gave us masks, like out of a movie, like E.T.
It was very overwhelming knowing that this is kind of a big deal.
It happened so fast. To go from having a pain in her shoulder to all of a sudden being in an isolation room, it was just terrifying, and Courtney was still in pain. They said since we'd already been in contact with her so close, Greg and I couldn't leave the room.
Doctors place the entire family in isolation, and there's one particular disease they are most concerned about.
Based on the look of the CT scan, she could potentially have tuberculosis.
Tuberculosis is a condition that typically affects the lungs. It is one of the deadliest diseases on the planet because the bacteria that causes it is actually able to evade the immune system.
It was really bad.
Now it's getting a little scary. Just a tiny bit scary.
To confirm their theory, doctors run numerous tests. 2 days later, the results of the tuberculosis test comes back.
For tuberculosis, the testing was negative.
Without a diagnosis, Courtney's health continues to plummet.
Every once in a while, an alarm goes off and they come running in.
Go get a doctor.
Because her oxygen level has dipped so low. It was really, it was scary. And still, we didn't know what was going on. Yeah, it's terrible. Sorry.
It came to the point where the doctor said, if we don't find out what it is, her lungs are going to fail within 2 days. And she was gonna die.